Hello everyone. This week is National Nurses Week from May 6th through May 12th. And I think we need to take some time to thank our correctional nurses this week for the hard work they do. We need to thank our nurses behind the walls who work in a high-risk area and face dangers every day just as correctional officers do. Hi, I'm Gary York, True Prison Stories. If you like this video, please subscribe. Let's talk about correctional nurses and how we need to appreciate them. And I want to personally take this moment to thank all the correctional officers across the country's jails and prisons and detention centers. Thank you for your service. It is a high-risk job and often a thankless job, and you don't get thanked enough. And that's what we're going to do today. You know, nurses work in our jails and prisons, and they face all types of medical issues. They have regular medical issues like colds and flus and sinus and upper respiratory infections, and I got a boo-boo on my finger, and my arm hurts, my leg hurts, and all those kind of things they have to deal with every single day. But they also have to deal with many patients behind the walls in the prisons and jails that are infected with sexually transmitted diseases. They are infected with HIV because we have a lot of drug users that come into our prisons and jails, and they are dealing with these needles and up-close contact with all these patients. They also have to do emergency medical response. Our nurses behind the walls, our jail and prison nurses have emergency medical responses at any time. We don't know if there's going to be an inmate with a seizure, an inmate attacking an inmate attacking an officer. And now we have people who need medical treatment immediately. And the nurses are the ones that come to aid us. And I mentioned correctional officers also because how many of you besides me out there in your career have been helped by a nurse in any type of situation? Maybe I've seen officers, nurses come because they're having a heart attack, and the officers are being helped by our corrections nurses, and they're doing life-saving steps until EMS gets there to transport the officer to the hospital, to the outside hospital. I've seen nurses just take blood pressure of officers because they feel they're getting a little antsy, a little hypertension, or they feel chest pain, and they're taking the vitals of correctional officers. So it's not only inmates that the nurses treat daily, they're there to help us also, and you have to remember that. We need them. They are part of our team. And nurses also have to deal with attacks by inmates. Sometimes they administer drugs or medication to an inmate, and I've had a case where an inmate had a hidden razor blade, and the nurse is trying to help the inmate through the food slot, and as she's trying to give the inmate medication that he needs and wants and requires, he cut her hand with a razor blade. I've seen inmates become angry with nurses because the medication prescription has run out, and by law she cannot give the inmate the medication until the doctor renews the prescription. And I haven't seen it, but I've investigated cases where the nurse was hit or attacked by the inmate because they're angry about their medication. And then we have to investigate and put new charges on the inmates, but the main thing is the nurses are always in harm's way. I think we forget that sometimes, and we need to thank our nurses. You know, these are nursing professionals that treat a wide variety of medical problems each and every day in the prisons and jails. They bring the gift of their healing into an underworld of thieves, drug addicts, murderers, rapists, child molesters, who have the right to medical treatment and have the right to care, custody, and control. And they have to do this to these people just like they would if they worked in a hospital on the outside. And let me tell you something. Sometimes I wonder if they don't do more treatment in the prisons and jails than a regular nurse does at a hospital. Because there's, what, 2 million approximately inmates in the United States jail and prison system. And we have over millions and millions of doses of medications a year distributed by our prison and jail nurses. And they sometimes have to administer this 3 times a day to certain inmates. So they're always moving, they're always busy. They have medical call. Jails have med pass. We have med call. They're kept on their toes, and in between medications, in between emergencies, in between reading medical request forms, they're doing all their paperwork. They have to keep their paperwork up to date by law. There is just a large amount of work for the nurses in jails and prisons. So when you guys working at the jail see a nurse and you're talking to her, and I'm talking about you officers and other prison staff, and she's kind of, yeah, that's a sign, guys. Go on and do your work and leave them alone. They're very busy. They're concentrating on their paperwork and taking care of inmates. We all know what I'm talking about with that. So let's thank a nurse today, whether it be on the street or in the jail. But today specifically, I want to talk about correctional nursing and nurses behind bars and the hard job they have. Thank you very much for what you do. It is also Correctional Officer Week. I think the days just miss each other by 1 day. So we want to thank all our correctional officers also. And I did a video on that last year on thanking correctional officers. But I wanted to do one on the nurses. And folks, there's also our mental health nurses. I mean, they're all nurses, but mental health nurses and psychologists. Let's thank the mental health nurses and psychologists just as much. They really have a tough job, and all the nurses in the prisons and jails have to deal with mental health patients. Another one I didn't mention earlier, which is just a very tough job to do. So I think in the prisons and jails, nurses see a wide range of mental illness, drug abuse illnesses, sexually transmitted illnesses, a little more than they would in a regular hospital. I could be wrong. I'm not a doctor. I'm not in the medical field, but I'm trying to get a point across of how dangerous and high risk their job is. Thank you very much for what you do. We appreciate you. God bless. Happy National Nurses Week. Please subscribe.